Now, what are the ESC guidelines telling us? And we will come back to that on the talk from Professor Dunker as well. They indeed say and recommend us that in the patient population after acute myocardial infarction, prior to discharge, an assessment of the left ventricular function is recommended, because that again tells us about the potential risk. And in those where we have an impaired one at baseline, repeat that not after the 3 months, which is usually recommended as a minimal period of time to up-titrate heart failure medication, even a bit earlier. However, even though we know that the risk for sudden death is the highest in the very early phase, the guidelines still recommend that heart failure medication has to be up-titrated in those who are in the context of a primary prevention, and we should ongoing that for at least 3 months. So there is a time period in between where the patient will most likely improve thanks to the medication, thanks to the time, where he or she is not yet having a defibrillator, but they're still at the highest risk. So somehow we need to bring that together and to prevent sudden death in that period of time, to give an alternative and to offer something that the patients are being protected. Because we also have seen that a very early implant of a defibrillator after acute myocardial infarction in those who at that time qualify for a device is not changing mortality. So we have patient population at risk after acute myocardial infarction with an impaired left ventricular function. If we implant an ICD in the very early period of time, at that time where the risk for sudden death is the highest, we are not changing mortality.